everybody, Dr. Dusty here, and today I'm going to cover some more data with you regarding your discs. And basically, so the topic is chiropractic care and your spinal discs. Now again, the neck, you have 7 vertebrae in your neck, 12 vertebrae in your mid-back, and 5 lumbar vertebrae, each of which has a disc in between them. Now the disc acts as a ligament holding the spine together. The disc carries downward weight of the body in an upright position, and the disc acts as a pivot point, allowing you to twist and bend. So it's a very important thing for you to be able to do, of course, in range of motion and such. So it acts as a ligament, holding it together, carries downward pressure and weight of the body in an upright position, and it acts as a pivot point in range of motion. All right. Now, I just wanted to go over some basic information on a normal disc. A normal disc consists of the outer surface of the disc. It consists of this black line. That's the annular fibers or the annulus fibrosus. That's if you could just picture in your mind these that black circle, having multiple black circles around this inner part called the nucleus. Now the nucleus is a watery gelatin type of substance that has a certain amount of hydrostatic pressure inherent in it. Now when water is encapsulated in kind of like a water balloon situation, it has a pressure that keeps the disc material intact. Now, when the disc material is intact and the watery substance has this hydrostatic pressure going on, it keeps the nerves from growing into the disc. So there are nerves that are on the outer surface of the disc, and with this pressure of the nucleus exerting on the disc, it keeps the nerves from actually growing into the disc. All right, now in a situation where the disc starts to progress into a degenerative disc disease situation or arthritis, you begin to see the watery gelatin-like substance begins to break up and migrate outwards, and in some cases it can actually herniate out of the disc proper and create big problems for the patient. Now, as this hydrostatic pressure decreases, you begin to see the nerves starting to grow into the disc, and that in that situation, patients start to become more painful, and they actually get what is called discogenic pain from the disc nerves itself. Now it's hard to determine, the patient can't really determine, well, I have discogenic pain or not. This is just kind of in an evaluation of the patient as to where the pain is coming from. And a determination is made, well, that's probably some of that pain is a discogenic origin. All right. So you get this decreased hydrostatic pressure, you get the water migrating from the center out to the outer portion. If that water gelatin substance comes in contact with the nerve roots themselves, that can be a very painful situation also, because there's certain chemicals in the watery substance that when they come in contact with the nerves can cause more pain. So it's important to keep this disc material intact and not get this degenerative disc disease. All right, so you might ask the question, well, what do you do in this situation when you get this degenerative disc disease? Well, that's where chiropractic care actually comes in. So adjustments can help restore the normal movement patterns of the vertebrae, which actually helps to bring nutrition back into the disc. It actually helps to bring water back into the disc. It helps to restore the normal flexibility of the spine, which in turn you get better movement patterns, and you start to see some of this disc material actually be restored to a better functionality because of the adjustments. Now in my office, we use chiropractic adjustments to do that, to restore that disc to a better shape. We use flexion distraction, Cox flexion distraction technique, which is a technique that actually starts to put some pressure on that disc to actually change the situation of hydrostatic pressure by bringing nutrition back into the disc. Because remember, the disc does not have a direct blood supply. The nutrition that is supplied to the disc is brought in by changing and altering the movement patterns to a better situation by doing chiropractic adjustments and of course exercise. And of course, as part of the whole equation, restoring this disc to a better functionality would be better nutrition, losing weight, getting more exercise and all that to help restore the normal functionality of the disc. So if you suspect that you have a problem with your discs, and in most cases when you have low back pain or neck pain or pain in your mid back, you probably have some of this situation going on where you have a disc problem and you're starting to see some of this pressure in the nucleus or the middle of the disc start to change, and you start to get this pattern of nerves growing into the disc, creating more painful situations. So give our office a call if you have a question about your pain and what needs to be done. I'd be happy to get on the phone with you or do a personal consultation here in the office. We could also do a free pressure point therapy session where I'd actually do some muscle pressure on your lower back using pressure point therapy on your neck also. And I can help you determine what situation you are in and what needs to be done to handle your problem. So our contact data is below, and you can contact via phone or an email. And I'd love to answer your questions regarding this. If you know somebody that has some pain in their lower back, has some pain in their neck, forward this video on to them, all right? So also, I want you to punch the like button, and we look forward to seeing you come into the office and helping you restore your health through natural chiropractic health care.